At approximately 35 weeks into your pregnancy, your provider will have you take a Group B Streptococcus or GBS test. Let's talk about what GBS is and why this test is so important for a healthy birth. GBS is a type of bacteria that can live normally in a woman's genital or urinary tract, and it's considered a normal type of bacteria. It is not a sexually transmitted disease, and no treatment is indicated for women who have the bacteria. However, during delivery, when a baby is moving along the birth canal, it can be exposed to GBS and unfortunately can become very sick. Before routine testing for GBS, about 1.7 babies out of 1,000 births would become seriously infected after delivery. Because of this, we now routinely test women to see if they carry GBS in their genitourinary tract, reducing the incidence of serious infections to just 0.22 cases per 1,000 births. Your provider may either give you instructions for doing the swab yourself in the bathroom during your prenatal visit, or may collect the swab for you during the visit. If you have a strong preference for one option or the other, please talk with your provider to let him or her know. This is the swab, and it's swept around the outside of the vagina, down the perineum, and into the rectum briefly. Your provider will contact you with the results of your test. If you do carry the bacteria, you're given antibiotics through an IV during labor to prevent transmission to the baby while it's traveling through the birth canal. If you've had a urinary tract infection during pregnancy that was due to GBS bacteria, you don't need a swab because you're already known to have the bacteria, and you'll be given antibiotics during labor as well. Antibiotics are safe for pregnancy and for breastfeeding. If you have a known allergy to penicillin, it's important to let your provider know when the GBS swab is being collected, as special testing will be done to identify the best alternate antibiotic to use instead. GBS testing is just one of the many ways that we work to prevent problems before they occur, protecting you and your baby during your labor and delivery experience.